Hello, guys. Welcome to another episode of the Clinical Cortex podcast. I'm your host, Dr. Rubani Iqbal, a resident in pediatric medicine with an active interest in clinical neurology and clinical medicine. Today's episode will be about the human brain, architecture, discovery, and hope. Today, we are exploring the human brain at an inflection point in neuroscience and clinical practice. For the past 2 decades, psychiatric treatment relied on empirical trial and error. Today, we are transitioning to mechanism-based, circuit-informed precision medicine. In the next 30 minutes, we'll examine 4 critical areas. हम 4 critical areas के ऊपर बात करेंगे. First, the functional architecture of the human brain. The neural systems that, when compromised, define the conditions we manage daily. Neural system जो dysfunctional होते हैं जब, तो we get behavioral symptoms and varied psychiatric disorders. Second, the current frontier of neuroscience. Blood-based biomarkers, advanced connectomics, brain-computer interfaces, and predictive neuroimaging that are reshaping clinical diagnosis and prognostication. And at the third चीज़ जो हम आज डिस्कस करेंगे, recent breakthroughs in psychiatric pharmacology and neuromodulation that represent genuine paradigm shifts in treatment efficacy and tolerability. And the fourth issue that we'll discuss today will be immediate bedside relevant applications you can implement in your practice. At the end, I'll be giving you take-home points and what will be most important to change your practice and the points that will be most useful to you by the bedside that will be able to help you in your clinical practice. This is grounded in current evidence from the highest impact journals. We are not discussing speculation. We are discussing mechanism-driven advances that change how you approach diagnosis, prognosis, and treatment. So settle in, guys. At first, we'll talk about brain architecture and function systems. How the various function systems are organized in the human brain. How various systems of neurons are meant for different functions. Let's establish the fundamental organization of the human brain. Rather than discussing anatomical regions in isolation, conceptualize the brain as functionally integrated systems. When pathology disrupts these systems, through, for example, जब patient को stroke हो जाता है, neurodegeneration, like Alzheimer's disease, in frontotemporal lobe degeneration, neuroinflammation or developmental abnormality, clinical manifestations follow predictably from the systems affected. जो भी system affected होगा, उसका dysfunction behavior में patient को reflect होता है, because various systems are assigned different functions in our brain. Understanding which systems are compromised refines your differential diagnosis and informs your prognostication. Exactly. जो भी system affect होगा, behavioral जो manifestation होगी, that will point you towards that system. Your differential diagnosis will get narrow. The human brain contains approximately 86 billion neurons, organized within structures that can be understood both anatomically and functionally. हमारे एक इंसानी दिमाग में एवरेज 86 बिलियन न्यूरॉन्स होते हैं. For those who don't know, neurons are basically cells, fundamental units जिन पे हमारी ब्रेन में न्यूरल कंप्यूटेशन होती है. Neurons are those cells जिनके बेस पे हमारा ब्रेन फंक्शन करता है. Clinically, this organization determines how pathology manifests and how recovery occurs. The prefrontal cortex, the PFC, executive function and behavioral control. जो हमारी prefrontal cortex होती है, whether right or left, the prefrontal cortex is meant for executive function and behavioral control. जो हमारा executive function होता है और हमारे behavior को control करती है, जो हमें moral और immoral के बीच में differentiate करने की ताकत देती है. Based on which the functions of prefrontal cortex help us to differentiate what is moral and what is immoral, what is right and what is wrong, what is morally correct and what is morally not correct. The dorsolateral prefrontal cortex, DLPFC, serves as the executive control system in our brain, mediating executive function, working memory, impulse inhibition and decision making. ये हमें impulse control में help करती है और decision making में, because अगर इंसान का emotional brain overdrive करेगा तो our desires, inner desires, which are sometimes good and which are sometimes bad. So जो हमारा लॉजिकल कंट्रोल होता है ऑन आवर इमोशनल ब्रेन दैट कम्स फ्रॉम prefrontal cortex, mainly the dorsolateral prefrontal cortex. It helps us in executive function, working memory, impulse inhibition, and decision making. Critically, the DLPFC shows measurable volumetric and functional decline with normal aging, beginning in the third and fourth decades. 30 और 40 साल के जब इंसान हो जाता है तब वॉल्यूमेट्रिक रिडक्शन देखने को मिलती है प्रीफ्रंटल कॉर्टेक्स में. That means pathological disruption of the DLPFC occurs in major depressive disorder, generalized anxiety disorder, ADHD, frontotemporal dementia, and traumatic brain injury. Here it is. जो pathological disruption or dysfunction होता है dorsolateral prefrontal cortex में, it is seen in major depressive disorder, in generalized anxiety disorder, attention deficit hyperactivity disorder, and frontotemporal dementia and traumatic brain injury. So इन सब conditions में हमें पैथोलॉजिकल डिसरप्शन मतलब डिसफंक्शन देखने को मिलता है डोर्सोलेटरल प्रीफ्रंटल कॉर्टेक्स का. दैट मीन्स दोज फंक्शंस विच आर असाइंड टू DLPFC विल बी अफेक्टेड, लाइक एग्जीक्यूटिव डिसफंक्शन होगा, वर्किंग मेमोरी इम्पेयर होगी, memory dysfunction which is the hallmark of dementias, among which Alzheimer's disease is the most common. Impulse disinhibition हो जाएगी, decision making में problem आएगी. So what's the clinical pearl here? A patient presenting with intact language, intact motor function, yet impaired planning, disorganization and behavioral disinhibition, localizes dysfunction to the prefrontal system. You ऐसे symptoms करके patient आएगा, you can to some extent localize कि dysfunction जो है वो prefrontal system में ही है. This finding changes your diagnostic approach to cognitive assessment, counseling regarding recovery trajectory, and selection of pharmacotherapy or neuromodulation. इस basis पे आप अपनी treatment को tailor कर सकते हो towards a particular aspect of the patient's disease. The anterior cingulate cortex, error detection and conflict monitoring. जो हमारी anterior cingulate cortex होती है, cingulate gyrus basically एक region होता है brain में. It is meant for error detection and conflict monitoring. The anterior cingulate cortex (ACC), located within the medial prefrontal region between frontal and parietal lobes, functions as the brain's error detection and conflict monitoring system. The anterior cingulate cortex, short में जिसको हम ACC बोलेंगे. The ACC evaluates discrepancies between expected and actual outcomes and signals the need for behavioral adjustment. The ACC evaluates discrepancies between expected and actual outcomes and signals the need for behavioral adjustment. Dysfunction of the ACC results in inability to recognize errors, impaired behavioral adjustment to feedback, and persistence of maladaptive responses. Functional and structural abnormalities of the ACC are documented in obsessive-compulsive disorder (OCD), hyperactivity, major depression, hypoactivity and volumetric reduction, and severe anxiety disorders and addiction. The severity of ACC dysfunction correlates with symptom severity and treatment resistance. So एक particular brain region जिसको हम anterior cingulate cortex बोलते हैं ACC, इसका dysfunction various disorders में देखा जाता है, like OCD, obsessions and compulsions जिसमें patient को होते हैं, obsessive compulsive disorder, hyperactivity देखी जाती है anterior cingulate cortex में, OCD में hyperactivity देखी जाती है anterior cingulate cortex में, major depression में hypoactivity and volumetric reduction, size छोटा हो जाता है ACC का, severe anxiety disorders and addiction. The severity of ACC dysfunction correlates with symptom severity and treatment resistance. The medial temporal lobe, the famous mesial temporal lobe. Memory consolidation and emotional processing. Mesial temporal lobe से मेरा जो पिछला एपिसोड था patient HM के ऊपर, hippocampus is located in the medial temporal lobe. For example, I'll give you an example. जो hippocampal sclerosis होता है, it is the most common cause of mesial temporal lobe epilepsy. So this was an example. And जो hippocampus होता है, it's involved in memory consolidation, long-term potentiation, those Schaeffer collaterals. So the medial temporal lobe, memory consolidation and emotional processing. The hippocampus, located within the medial temporal lobe, serves as a neurobiological gateway for explicit memory consolidation. Yes, explicit memory, जिसमें हमारा conscious effort लगता है. Information processed in the neocortex passes through the hippocampus before being stored as long-term memory. The amygdala, also located in the medial temporal lobe, functions as the emotional salience detector, identifying stimuli with emotional significance and triggering appropriate arousal and behavioral responses. Hippocampal volume reduction is documented in major depression, PTSD, and chronic stress. वॉल्यूमेट्रिक रिडक्शन देखी जाती है हिपोकैम्पस की इन मेजर डिप्रेशन, PTSD एंड क्रोनिक स्ट्रेस. एमिगडाला hyper responsivity to threat related stimuli characterizes anxiety disorders and PTSD. ये hyper responsive हो जाते हैं ऐसे patients with anxiety disorders and PTSD because underlying amygdala hyper responsivity होती है towards a particular emotional stimulus. Damage to medial temporal lobe structures not only impairs memory consolidation, the case of patient HM, but also disrupts emotional regulation and fear extinction, the fundamental process through which learned fears are deactivated. The parietal lobe, involved in sensory integration and spatial awareness. The parietal cortex integrates somatosensory information with visual and vestibular input to create the brain's representation of body position in space and the environment. Parietal lobe pathology, particularly right parietal dysfunction जो होता है on the right side, produces hemispatial neglect, a condition in which patients literally lose awareness of one side of their body in contralateral space. Occipital cortex damage produces visual field effects. However, a clinically important phenomenon occurs when visual cortex is damaged. Patients may develop visual hallucinations or what is called metamorphopsia, distortion of visual perception, as the remaining visual cortex attempts to fill gaps in visual information with corrupted or interpolated signals. It just means that visual hallucinations or metamorphopsia हो सकता है if there is damage to the visual cortex. These symptoms you see in those who are in neurology. You all must be familiar. Hemi-neglect, a symptom of hemi-neglect in stroke patients. The limbic system, emotion, motivation, and interoception. The limbic system, encompassing the amygdala, hippocampus, cingulate cortex, insula, and associated structures. Limbic system के जो बड़े players होते हैं, these are amygdala, hippocampus, cingulate cortex, insula, and associated structures. Processes emotion, motivation, and interoception, perception of internal bodily states. Critically, limbic processing is not separate from rational or executive brain function. Rather, emotional and motivational systems are integrated throughout decision making at all levels of complexity. The insula deserves particular emphasis here. Insula यहाँ पे particular emphasis deserve करता है. The anterior insula processes interoceptive signals, the brain's monitoring of internal physiological states, including heart rate, respiration, hunger, and thermoregulation. Insular dysfunction occurs in panic disorder, anxiety disorders, addiction, and eating disorders. Patients with insular damage lose explicit awareness of internal states. They cannot perceive anxiety until panic becomes physiologically overwhelming. They cannot perceive hunger until it becomes urgent. इंसुला के बारे में एक और इंटरेस्टिंग चीज़ है न्यूरोलॉजी में. इसको समटाइम्स फोर्थ लोब ऑफ द ब्रेन, फिफ्थ लोब ऑफ द ब्रेन भी बोलते हैं, इंसुलर कॉर्टेक्स. The brainstem, involved in arousal, neurotransmitter disruption, and life support. The brainstem, comprising the midbrain, pons, and medulla, constitutes a finite volume but manages foundational functions essential for survival. We all know brainstem कितना important है हमारे survival और हमें जिंदा रखने के लिए. The reticular activating system, RAS, maintains wakefulness and arousal. The locus ceruleus generates norepinephrine, distributed throughout the entire brain, mediating arousal and attentional allocation. जो हमारा locus ceruleus एक region होता है brainstem में, it generates norepinephrine, जिसको हम noradrenaline neurotransmitter एक होता है, one of the catecholamines. Locus ceruleus generates norepinephrine, distributed. Locus ceruleus generates norepinephrine, distributed throughout the entire brain, mediating arousal and attentional allocation. The dorsal raphe nucleus, DRN. The dorsal raphe nucleus contains serotonin-producing neurons that project widely throughout the brain. ये project करते हैं through the brain, dorsal raphe nucleus. इसके neurons throughout the brain project करते हैं. They are serotonergic neurons. They produce serotonin. When you prescribe SSRIs, you are enhancing the function of this single nucleus and its projections. So जब हम, for example, major depressive disorder या anxiety disorders या panic attacks, किसी भी चीज़ के लिए या OCD में जब आप SSRIs prescribe करते हो, you are enhancing the function of this single nucleus. That is, dorsal raphe nucleus का function आप enhance कर रहे हो ताकि serotonergic augmentation मिले brain में, or symptom relief for patient को. Brainstem pathology produces devastating consequences. Brainstem ischemia can produce locked-in syndrome, the famous locked-in syndrome. Brainstem जो ischemia होता है या ischemic stroke for example can produce locked-in syndrome, which will produce complete paralysis with preserved consciousness. Patient completely paralyzed हो जाता है, but inner consciousness जो होती है patient की preserve होती है. एक interesting चीज़ है locked-in syndrome के बारे में. इसमें पेशेंट आईज वर्टिकल आई मूवमेंट के थ्रू कम्युनिकेट करता है, बाकी रेस्ट all of the motor systems are paralyzed. Brainstem hemorrhage is frequently fatal. Clinically, respect the brainstem. Small lesions produce large deficits. So you should always be careful about the brainstem क्योंकि छोटे छोटे lesions बड़े बड़े neurological deficits produce कर सकते हैं. The cerebellum. Motor coordination, timing, prediction and cognition. Cerebellum जो छोटा सा part होता है behind the main cerebral cortex के पीछे. It's a little part, but it has a very large number of neurons and is very important for motor coordination, timing, prediction and cognition. Even cognition के लिए भी. Cerebellum का जो हमारा motor control and coordination का जो thinking है that it is involved only in motor control and coordination. Motor control and coordination, it's not only in motor control and coordination, it's involved in cognition as well. The cerebellum constitutes approximately 10% of brain volume, yet contains approximately 80% of all neurons. Estimates vary, some say 50%, some say 80%. Traditionally understood as the motor coordination center, modern neuroscience, particularly research from laboratories studying cerebellar connectivity and function, has demonstrated that the cerebellum is deeply involved in working memory, temporal processing, prediction, and emotional regulation. Cerebellar degeneration produces ataxia in motor and coordination. However, patients with cerebellar pathology also manifest cognitive decline and mood disturbance. This is clinically relevant. A patient with ataxia and depression should prompt consideration of cerebellar pathology as a primary contributor. यहाँ पे patient को आपको दिखे ataxia भी है along with depression. So you should think that something is wrong with cerebellum. Subcortical relay and modulatory systems. The thalamus functions as the brain's primary relay station. Thalami जो on both sides दो thalamic nuclei होते हैं basically. Gateway to the cerebral cortex बोलते हैं thalamus को. ये sensory relay station काम करता है कि cortex तक क्या जाएगा. The thalamus functions as the brain's primary relay station. Sensory information ascending from the spinal cord routes through thalamic nuclei before reaching cortex. Thalamic infarction produces contralateral somatosensory loss. Critically, thalamic pathway can produce central post-stroke pain, a syndrome of intractable neuropathic pain following thalamic ischemia, representing one of the most treatment-resistant pain syndromes encountered clinically. Thalamic strokes जब होते हैं, what is called Dejerine-Roussy syndrome बोलते हैं इसको, thalamic pain syndrome. So thalamic ischemia या thalamic strokes में patient suffers a form of intractable neuropathic pain, one of the most treatment-resistant pain syndromes in neurology. The basal ganglia, comprising the striatum, globus pallidus, and substantia nigra, control motor initiation, motivation, and action selection. Dopamine neurons within the substantia nigra project to the striatum. Degenerate in Parkinson's disease. ये जो निग्रोस्ट्रिएटल पाथवे होता है, इसकी डोपामिनर्जिक न्यूरॉन्स की डिसरप्शन होती है पार्किंसंस डिजीज में. What is responsible to produce symptoms of Parkinson's disease? In mediate reward processing and habit formation. These are one of the basal ganglia. For those who don't know, substantia nigra and जो striatum होते हैं, these are striatum जो ये होता है, corpus callosum होता है, putamen होता है, globus pallidus, internal external segments होते हैं. These are basal ganglia, basically. Basal ganglia, for those who don't know, these are deep gray these are deep subcortical gray matter nuclei within the brain. So the basal ganglia, comprising the striatum, globus pallidus, and substantia nigra, control motor initiation, motivation, and action selection. Dopamine neurons, dopaminergic neurons. Dopamine neurons within the substantia nigra project to the striatum, degenerate in Parkinson's disease, and mediate reward processing and habit formation. The same dopaminergic circuits involved in motor function are involved in motivation and reward. explaining why Parkinson's disease patients experience depression at significantly elevated rates. और Parkinson's के बारे में एक interesting चीज़ ये है कि depression and depressive symptoms can precede Parkinson's disease rampant manifestations जो होती हैं by a decade. एक decade, some decades से पहले depression हो सकती है Parkinson's disease patients में. The hypothalamus, though small, regulates temperature homeostasis, hunger, thirst, circadian rhythm, and the entire hypothalamic pituitary adrenal axis, what is called HPA axis. Hypothalamic dysfunction does not merely disrupt hormone levels. It disrupts sleep architecture, appetite regulation, stress responsivity, and reproductive function. So now, coming to second section of our podcast, in this section we'll be focusing on major recent discoveries in neuroscience. जो neuroscience, clinical neuroscience, psychiatry and neurology, जो major recent discoveries हुई है. The pace of discovery in neuroscience is accelerating. In the past 18 months, advances in biomarker development, neuroimaging and clinical translation are reshaping how we diagnose and prognosticate neurological and psychiatric disease. These are not theoretical advances, they directly impact patient care. These are not theoretical advances, they directly impact patient care. The first जो major discovery है in recent times in clinical neurology and neuroscience, plasma phosphorylated tau and amyloid-beta, blood-based biomarkers for neurodegeneration. Alzheimer's disease, basically, for those who don't know, Alzheimer's disease is a form of neurodegenerative disease. It is the most common form of dementia above the age of 65 years. जो इसके neuropathological hallmarks होते हैं Alzheimer's disease के, these are phosphorylated tau. They form neurofibrillary tangles and beta amyloid proteins. Alzheimer's disease basically एक decade से ऊपर मेरी research का main focus रहा है cognitive decline and cognitive dysfunction. And उसमें जो basically मेरा जो primary जो मुझे disease जो मेरा main focus रहा है besides my medical career, it was Alzheimer's disease. I have read a lot of literature as well in books about Alzheimer's disease. तो इसका जो main hallmarks होते हैं, it basically literally eats a brain from the insides, and the patients, it disrupts patients memory and cognitive dysfunction. So जो plasma phosphorylated tau and amyloid beta, blood-based biomarkers for neurodegeneration. For decades, diagnosis of Alzheimer's disease relied on cognitive assessment. एक तो cognitive assessment, और सबसे जो बड़ी प्रॉब्लम है इन द डायग्नोसिस ऑफ अल्जाइमर्स डिजीज़, हम तब इसको रिकग्नाइज करते हैं जब पेशेंट फुलमिनेंट सिम्टम करके आता है. तब तक ऑलरेडी डैमेज बहुत ज़्यादा हो गया होता है. वी बेसिकली नीड टू पिक अप दीज डिजीज़ एट द अर्लीस्ट एंड देयर इज़ एविडेंस के दीज डिजीज़ जब तक सिम्टोमेटिकली मैनिफेस्ट करेंगे तब तक बहुत लेट हो गया होता है. वी हैव टू पिक देम अर्ली एंड वी हैव टू इंटरवीन अर्ली. For decades, diagnosis of Alzheimer's disease relied on cognitive assessment and MRI brain, obviously. A patient presenting with memory loss was presumed to have Alzheimer's disease. Yet, longitudinal studies documented diagnostic accuracy of approximately 80% based on cognitive evaluation alone. Structural MRI and PET imaging refine diagnosis but remain indirect measures of underlying pathology. The 2024 Lancet Neurology Comprehensive Review of blood-based biomarkers represents a paradigm shift. Plasma phosphorylated tau, जो phosphorylated tau proteins होते हैं, mainly p-tau 181 and p-tau 217. So these are two proteins, p-tau 181 and p-tau 217, plasma-based biomarkers. क्योंकि Alzheimer's disease के पीछे people are spending a lot in research to pick up blood-based biomarkers, neuroimaging biomarkers के किसी तरह early on ये disease pick up हो जाए. So we have p-tau 181 and p-tau 217, phosphorylated tau ratios, and amyloid beta 42 and 42 or 40 ratios now. These ratios now enable identification of individuals with Alzheimer's pathology 10 to 15 years before symptom onset. plasma phosphorylated tau, p-tau 181 and p-tau 217 phosphorylated tau ratios, and amyloid-beta 42 and 40 ratios now enable identification of individuals with Alzheimer's pathology 10 to 15 years before symptom onset. These biomarkers predict cognitive decline trajectory and enable risk stratification. The clinical implications are substantial. A patient with subjective cognitive concerns of mild cognitive a patient with subjective cognitive concerns or mild cognitive impairment, जिसको हम NCI बोलते हैं, can now be risk stratified based on plasma biomarkers. अब हम risk stratify कर सकते हैं कि कितना risk है इसको Alzheimer's disease, fulminant dementia का. Positive biomarkers direct toward amyloid modifying therapies, जो आजकल जो recent times में हमने monoclonals देखा गया है, aducanumab, lecanemab, donanemab. So इन monoclonals के ऊपर basically recently मैंने एक book पढ़ी थी by neurologist जो unluckily खुद एक शिकार है Alzheimer's disease का. So उसने both from a patient and doctor's perspective बहुत अच्छा account दिया है how it feels to see the disease from both sides, from both a patient as well as a clinician's perspective. Dr. Daniel Gibbs, I think his name was Dr. Dan Gibbs. The book's title was A Tattoo on My Brain. It was basically derived from the side effect, an interesting side effect and dangerous side effect of these monoclonals, and that's called ARIA, ARIA, amyloid related imaging abnormalities. So monoclonals लेने के बाद micro hemorrhages, tiny edematous areas हो जाते हैं brain में, that can be really dangerous. Those are called ARIAs. So this was a little bit about these monoclonals. So positive, but they are undoubtedly very useful, turning out to be really useful for patients of cognitive decline in Alzheimer's disease. Positive biomarkers direct toward amyloid modifying therapy like aducanumab, lecanemab, and donanemab, because the field of Alzheimer's disease and dementias is very desperate. We did not have disease modifying therapies for a very, very long time. And we all know the scale at which Alzheimer's disease is affecting people or is going to affect people as the lifespan is increasing. Positive biomarkers direct toward amyloid modifying therapies like aducanumab, lecanemab, and donanemab. Negative biomarkers redirect diagnostic thinking toward non-Alzheimer's pathologies or cognitive complaints of non-degenerative etiology, because dementia के बहुत सारे differential diagnoses बनते हैं. So clinical takeaway here will be what you need to take away. What's the take-home point here? In your cognitive impairment workup, order plasma phosphorylated tau and amyloid-beta ratio. So अगर cognitive decline के workup में अब आप we now have blood-based biomarkers. ये जो phosphorylated tau proteins की ratios हैं या beta amyloid proteins की ratios हैं, we can now order them if your lab or your local hospital is doing those tests. So these tests are blood-based, widely available, and substantially improve diagnostic confidence. They inform prognostication and guide treatment selection. This is not a small thing, because Alzheimer's disease की जो treatment हमारे पास therapeutics हैं, they were dismal for quite a long time. So ऐसी monoclonals आना या ऐसे blood-based biomarkers अब आना, this is an extremely huge development in clinical medicine and neurology. Transformer models and connectomics, deep learning neuroimaging analysis. So transformer-based deep learning models, the same neural network architecture enabling large language models, are being applied to functional MRI data with remarkable results. This is where AI is integrating into clinical medicine and research. Models like BrainLM and BrainMAE learn representations of functional relationships between brain regions by analyzing patterns in fMRI recordings. These models identify disease states, predict cognitive function, and reveal circuit dysfunction that conventional statistical analysis misses. Connectome-based predictive modeling, mapping structural and functional connectivity between brain regions and relating these patterns to clinical outcomes, is reaching clinical application तक पहुंच गई है. It is reaching clinical application. Researchers are identifying connectivity patterns that predict cognitive decline trajectory, treatment response, and relapse risk. So within 5 years, neuroimaging will be transformed from a diagnostic tool to a prognostic and predictive tool से. Diagnostic tool से ये एक prognostic और predictive tool बन सकता है neuroimaging within next some years. Imaging will tell you which patients will recover and which will plateau. इमेजिंग से आप बता पाओगे because of the recent technical advancements, which will respond to pharmacotherapy and which will require brain stimulation or surgical intervention. This is interesting. So now we'll shift to a famous disease in neurology, multiple sclerosis. 2024 McDonald criteria, MS diagnostic revolution. So the 2024 McDonald criteria represent fundamental change in multiple sclerosis diagnosis. The previous diagnostic framework required demonstration of spatial dissemination. Lesions का spatial dissemination required था, जो previous हमारा criteria था to diagnose multiple sclerosis. The previous diagnostic framework required demonstration of spatial dissemination. Lesions in multiple CNS locations at different times. So spatial dissemination in space and time. The revised criteria provide a unified diagnostic framework applicable across all ages and disease courses, with expanded anatomical regions now included in diagnostic evaluation. Critically, the revised criteria expand recognition of anatomical locations, now including the optic nerve as a site of demyelinating lesions. अब optic nerve को भी include किया जा चुका है as a site of demyelinating lesions. Now we will look for demyelinating lesions in the optic nerve as well. This expansion enables either earlier MS diagnosis. Patients are now diagnosed at the relapsing remitting stage when disease-modifying therapies are maximally effective before substantial disability accumulates. So for those who do not know, MS का जो diagnostic criteria था, it's called that's called McDonald criteria. Those Dawson's fingers, you may remember Dawson's finger, those focal areas of demyelination. So what's the clinical implication here? Earlier MS diagnosis means earlier access to disease-modifying therapy when the CNS retains maximum plasticity and when disability burden can be minimized. So earlier अगर MS pick up हो जाती है तो it will be extremely useful for the patient क्योंकि neuro disability और disease burden से patient काफ़ी हद तक बच सकता है. We can administer disease-modifying therapies early in the course of the disease. Now shifting gear to tech. So brain-computer interfaces. From research to bedside. जो BCIs हैं, how they are transitioning from research to the bedside. और ये जो transition रही है from bench to the bedside, that has always been my primary focus. I like that transition a lot and to work in that transition. Brain-computer interfaces from research to bedside. Research published in 2024 and 2025 demonstrates that speech neuroprocesses decoding intended speech from motor cortex activity are achieving real world utility. So सीधा motor cortex से हम patient क्या कहना चाहता है वो tech के through interpret कर सकते हैं and at the pace of human speech हम उसको translate कर सकते हैं कि patient क्या कहना चाहता है. In speech neuroprocesses for the patients who cannot speak. Patients with severe paralysis and intact cognitive function can decode intended speech at rates approaching natural conversation jitni. This is amazing. Landmark studies demonstrate that cortical codes for speech production persist for years after motor paralysis. The brain does not forget how to generate speech. क्योंकि brain still can generate speech अगर patient को motor paralysis भी है. It can be read and translated to text or synthesized into speech. So हम direct motor cortex से speech को treat कर सकते हैं with the help of modern technology and translate into either text or synthesized speech. This represents genuine neuroscience meeting clinical need. A locked-in patient retains cognitive capacity and motor intention but lacks motor output. BCIs, brain-computer interfaces, restore communication by decoding intention directly from the cortex से pick up करके. That will be huge help for a patient with locked-in syndrome. जिसकी cognition intact है but motor paralysis है. Now shifting gear to epilepsy. So seizure detection technologies. Preventing SUDEP, sudden unexpected nocturnal death in epilepsy. So the FDA has cleared novel devices for real-time seizure detection. FDA ने एक novel device clear किया है for real-time seizure detection के लिए ताकि ये जो sudden unexpected nocturnal deaths in epilepsy हों इनको किसी तरह prevent किया जाए to pick up when the patient is having seizures. So EpiWatch, implemented as an app on Apple Watch, detects tonic-clonic seizures with high sensitivity. So EpiWatch एक app लॉन्च हुई है ऑन बेसिकली अवेलेबल ऑन एप्पल वॉच, डिटेक्ट्स टोनिक-क्लॉनिक सीजर्स विद हाई सेंसिटिविटी. नाइट वॉच डिटेक्ट्स नॉक्टर्नल सीजर्स इन चिल्ड्रन एजेस 4 to 16 ईयर्स. सो 4 से 16 साल के बच्चों में अगर नाइट टाइम के वक्त वॉच कैन डिटेक्ट सीजर्स, ताकि pseudeps, sudden unexpected nocturnal deaths and epilepsy prevent की जा सके. These devices enable real-time notification of seizure occurrence. ये notification भेजेंगी जब patient को seizure होगा. So sudden unexpected nocturnal death in epilepsy. Pseudep remains a significant cause of mortality in epilepsy patients. So ये जो sudden unexpected nocturnal death in epilepsy होती है, pseudep, it's a significant cause of mortality in epilepsy patients. Early detection and intervention potentially prevent these events. Wearable technology provides objective real-time seizure documentation, valuable for treatment monitoring, safety assessment, and patient education. So what's the clinical pearl here? Discuss wearable seizure detection technology with your epilepsy patients. So you can now deliberate on this, whether patient want it or not. They can wear this watch, and this can help them a lot. The evidence for efficacy and utility is established. This is not experimental. It is clinically available. Apple Watch is clinically available as an app on the Apple Watch.